Without further ado, let's get on. Time for our informative discussion panel. The role of science, research, and regulations in shaping safer and more transparent food systems. I'm super excited for this group. I'm looking forward to it. A warm welcome to our speakers, the Director of Scientific and Regulatory Affairs at Coca-Cola, Dinesh Pravankara, the Food Science Professor at Cestar College of Business, Health, and Technology, Pravik Yusefian. Our Regulatory Affairs at Nestlé Health Science Canada, Maeda Dervik, and your moderator, which some of you already know, the Director of Regulatory Affairs at Nestlé Health Canada, Ms. Jacinta Roberts.
Thank you very much.
Oh, okay.
Well, good afternoon, everybody. We're very much looking forward to this panel. I think regulation is very near and dear to each of the panelists' heart, as well as my own, and I think for everybody in this room, which is why you're here. So I thought we'd jump right into the first question, which is, for each of you, from your perspective, what's the single biggest gap that you see in current food labeling? And what does the latest research tell us that consumers need to be able to make safe and informed choices? So Dinesh, can I start with you?
Sure. Thank you. Hi, everyone. Great to see you. And from my perspective, the single biggest gap, I think, is labels are designed to meet the regulatory requirements. So what it means is, we have a set of rules that we have been set up by Health Canada, and we are trying to put all those rules into a label. But from a consumer perspective, when you look at that, does it meet what they need? When you look at a mom or a dad going for shopping, what they look at is, do they have the information to make a decision in a split second of time? Does anybody know how much second does a consumer spend on a label? Just a quick idea. Less than probably 15 seconds or very, very little time. So do they expect you to go, so the government, the Health Canada, expect to go and read those labels, whether it is a combination of maths, because you need to know the serving size, you need to understand what the daily value percentage is, you need to understand what the ingredient list is, does it have allergen in it, does it have all the other things to it, and they have to make a decision based on all those things. So the biggest gap I see is the label is an amalgamation of science, consumer behavior, and everything together. It's a legal document, and the consumer is expected to understand that label in a split second, which is not possible. So I think that the biggest gap is, how can the consumer make the informed decision by reading those labels and all those numbers in a very quick and easy fashion? I think they have taken some step towards the direction from an FOP perspective, but it is not the perfect solution. Those clues can help the consumer to make the right decision when purchasing a product, but I think there is a long way to go for the actual use of these regulations into a label. So that's my perspective.
Thank you. Yusuf, since you actually come from a professor background, a teaching background, I'd love to hear your unique perspective as well.
First of all, thank you so much for giving me this opportunity to talk to a wonderful audience. From my perspective, first of all, we have to define the words consumers versus customers. Because the customers are people like you and me. We are buying the products, and we are, in fact, the last elements of the food chain to receive the food. And obviously, the question is for consumers, for sure. But the customer, with respect to what you know, that these days you have supplier, customer, supplier, customer. You're a manufacturer, you are a customer of your suppliers. And you are supplier of the grocery stores, they are your customer. And eventually we come to the consumers. Consumers are, honestly, very confused. And we don't expect them to be clear yet, even though the CFIA is trying to make the label of information as clear as possible, as my friend Dinesh mentioned, but still they have no idea, a lot of them. Even the expiry date or best before, or, they're like kind of the confusion. And that definitely their percentage value, daily value, I can guarantee lots of them, they don't know. They don't know. So they just trust, or they do not trust. This is the reality. Yes, they need to be more educated. And the companies, through their websites or government, should put more effort. Because one thing is very lost in the chain for this consumer. They have no liability. They have no responsibility how they handle the food that you guys putting lots of efforts to make the food safe, but they don't really care because they just trust that what you make must be good till whenever I use and consume the food. So I guess they must be trained for that. They must be educated. Please.
But Maida, I know you have a unique perspective because your products, I think, are a little bit different in that you work in heavily fortified products. So what are your thoughts about consumers in that space?
Yeah, that's definitely an interesting space, but I would echo what Dinesh has said, that these are consumers that are still confused, very heavily confused, regardless of the level of fortification and regulatory prescriptions that we have for our products, which are meal replacements, nutritional supplements, et cetera. So they're food for special dietary use products. But I would say the fact remains that a lot of the time that we in all of industry, I think, assume that consumers are going to do a lot of due diligence, read the ingredient list, maybe know what a lot of these ingredients and these additives mean and what they do. As to your point, know what the percent DVs mean, compare across serving sizes. That is an incorrect assumption, and we kind of need to go from just strictly having our labels be for regulators, which is, I think, what historically they've been for regulators, and really more consumer interpretation vehicles and trust-building tools. Some examples are, you can see a product that says non-GMO plus plant-based plus vegan, all these nice things that maybe individually these things are all accurate and true, but that paints kind of an overall impression, I think, to a lot of consumers that maybe this is a healthy product. It's not necessarily a healthy product. So in a lot of ways, I think that we need to also take into account this overall impression that we're making in the food. And the other example is they could see, if they do scan the label, maltodextrin or modified milk ingredients, and they think necessarily that this is bad. This is not a healthy product, which that might not necessarily be true either. So if there's a way that we can kind of do a little bit more consumer gauging and consumer lens as we're thinking about these products and developing these labels, I think that's actually going to be for the better for ourselves and our consumers.
Thank you. I think you all hit on a very interesting point, which I can see a theme that the consumers trust in us, which is great because we very much are there to look out for them when we're creating our labels. But just like each of you have mentioned, I think we also assumed the regulator was also verifying how the consumer would understand the label when they were giving the regulations down to us. And I think now we all notice that we have an extra job in there.
Janet, can I give a quick example? So I don't know how many of you were there when I talked about supplemented food a couple of years ago, and that was brand new regulation at that time. And now it is fully enforced, and from January 1st of 2026, all the labels that are on the market should comply with the new regulation. So I was just shopping the other day, and one of the person was buying an energy drink product, and I was curious, and I asked him, do you understand what Supplement Health Canada means? And surprisingly, he told me that it is approved by Health Canada. So that's the level of understanding of what supplemented food means to the consumers, because the regulators can come up with all these regulations, but unless you have a proper campaign, educational campaign to make them understand what it exactly means, there is no point in bringing in new regulations. I think the education part of it, educational campaign part of it is what we lack. And there should be more efforts put into the campaign, education campaign. I know that that can be not done by the regulators, in isolation. It has to be done in conjunction with the industry and other stakeholders. So I think that is where the biggest gap is with these new regulations, because it's just not passing the regulation, it is actually how is it interpreted in the market by the consumers who are buying these products every day. So that's just something to add.
Thank you.
Can I add something, please? Another thing that I would like to add to this, answer to this question is, lots of people are, especially the consumers, are confused at what is the difference between healthy product or safe product. So they don't know. When you say this product is safe, it's not necessarily healthy, right? Or vice versa. And so this is another confusion that our consumers have if we do not educate them. But obviously, we have to make the education for them very simple. It's not like you guys are all educated people. So they're simple guys, and they have no idea what is less than 5% daily values versus more than 15%, and which the numbers work for what? For proteins? For fat? For what? We have no idea. So still, I think they must be very clear for some definitions. What is healthy food? What is the main objective of the labeling? You know very well. The main objective is make the consumers able to choose very healthy food choices. If they have no idea, if they're confused, they just buy, okay? So, and I think also the economy is another factor, especially these days, make the things a little bit more tough for people to go through the very healthy food. Thank you.
Thank you. So I'm going to say, shifting gears, I thought we'd talk a little bit about the evidence-based criteria for labels. What goes into them? The ingredients, the allergen, nutrition, any of the claims. So on that note, Mata, I'll start with you. How do you take complex scientific evidence and turn it into label claims that are both compliant, so meeting the regulator requirements, and also meeting consumers where they're at? It's a bit of a tension between the two.
Yeah, we talked about why it's important, and now it's the how do you actually do that? How do you actually make labels more easy to understand for consumers? We know that transparency is a big driver, of course, for consumer selection in products. I think the stat is something like 75% of consumers actually would switch to a brand that they view as more transparent. So this is something that is only now increasing. As we saw in Brad's talk yesterday, there's a misleading label or a food product that somebody deems misleading can put a video up on TikTok, and that can spread like wildfire. So I feel like now in this current era, we're just going to be seeing that accelerating even more. So I would say we really do need to start with, first of all, making sure that the label is truthful and substantiated, so any kind of label claim. So start with that as the number one. Like make sure the regulations first are met and that your label claims are substantiated. Going that extra layer to really satisfy that transparency piece and enhance that consumer understanding piece, you really do need to do more of an overall impression check. So as I said, something like supports immunity, right? Like, does that mean it boosts immunity? Does that just mean it maintains immunity? This is like some of the things that we see a lot on our products or our types of products. Or something like made with real ingredients, made with real food. Like, what does that mean? Isn't it all food? So these are the types of things that we're seeing a lot more of. So I would say we really do need to do a better job of trying to put more clear guardrails on some of these things. So rather than just saying supports immunity, okay, let's have a little bit of a qualifier as to what that means. It's vitamin C maintains the normal function of the immune system. So it's not the product, it's the components of the product that would technically make that more factually accurate. And I do think that that would also increase consumer understanding of what actually is doing the support immune function. Or something like made with real food. What is that? So maybe it's a quarter cup of apple puree in that product that's supporting that made with real fruit claim. So we really do need to be specific and put that consumer lens on, doing consumer comprehension studies, doing readability checks, even asking people who you work with in the office, hey, if you look at this label with all these unique elements on it and the complete picture that it portrays, what do you think it's trying to tell you? Like, what is your understanding of this label and these claims? You can use AI to help you with some of this. Has anyone used like Gemini, Copilot, or any of those tools to say, what would a reasonable consumer take away from this label? No one. I would highly recommend it because it's a fascinating tool that actually can be a good preliminary check. But I would definitely partner that with actual consumer comprehension studies to see like what is a reasonable consumer taking away. I think there's lots that we can do. I just think that we need to just have that as one tool in our toolkit and one item in the checklist of having a complete compliant label that then a consumer will hopefully increase trust in your brands.
Thank you for that, Maida. Dinesh, I'll jump over to you. So Coca-Cola operates across a number of product categories in a number of markets. How does your team decide which scientific evidence is robust enough to support your claims? And what internal governance do you use to make sure a claim actually meets your standard?
Yeah, great question. Yeah, Coca-Cola does operate across the world. I think there are only 2 countries that we do not manufacture. One is Cuba, and the other one is North Korea, but we pretty much sell in all the other countries, and now Russia as well. But to answer your question, yeah, this is very important. We looked at it from 2 perspectives. First is, what is the evidence for the claims that we make on our labels? So the evidence can be linked to the ingredients. So we make sure that those ingredients that we use for which we make claim are substantiated scientifically. So, Health Canada has a very good list of claims that you can make for all the vitamins that you add to the product. But you have to be careful about, you're not saying the product is going to help you. It is the ingredient or the additive or the vitamins in the product that is going to help you. So vitamin C is doing, plays a role in the antioxidant or whatever that claim is. So we make sure that those things are aligned. If it is a new ingredient, novel ingredient, we have to go back to Health Canada and make sure that we align with them with the approval of the ingredient as well as the claims associated with it. So Canada is very unique. But in other countries, like, for example, in the US, where my team also is based in US as well, they can make claims based on GRAS emissions, right? So which is not allowed here. So the GRAS emission serves as a reference point for them to add an ingredient to a beverage and then make claims. So we have to be careful where the jurisdictions we are, and making sure that how we incorporate that. The second part of our operation is the governance part, which is also very, very important. We have to use these things consistently across the globe. So we cannot say one product is so-and-so in US market, and then we can say this product does different thing in Canadian market. So you have to be aligned with your claims strategy, for that matter. So we have a team in the global operations, which is like basically global scientific and regulatory affairs. They look at the whole, scan the whole globe for scientific, substantiation and how different markets are doing different type of claims, and we have a combined strategy of how we adopt those claims in different markets. So which is also has to be vetted with the local experts like myself for Canada, to make sure that it is acceptable in the local market. So that is how I see the 2 different sets of things. One is substantiation of the claims with the evidence that we have from a scientific perspective. It has to be truthful. The format of the product, the dose values of the ingredients are very important, and it has to be truthful and not misleading. That's the basic argument that we always use to make a claim. So governance and substantiation is the main 2 pillars that we use for making sure that the claims are substantiated appropriately in each market. Thank you.
Perfect. Thank you. Parvis, let's jump over to you. So from an academic and food science standpoint, where do you see the most significant disconnect between published research and allergen thresholds or bioavailability of specific nutrients, and what actually appears on consumer labels today?
Sure. This is a very great question. But if I have permission, I also would like to add more materials to my experience from industry and education, and hopefully the beautiful audience will let me know if they agree or disagree, and I will learn from you more. So the science is always about, when it comes to the allergens, they are threshold quantitatively. Their focus is quantity. The quantity is their focus. So in other words, they are the dose-dependent studies. While in regulations, it's either it's binary, presence or absence, right? So we know that the allergens, they have different levels of reactions in different people based on their physiological functions. So we know that even the ingredients, we know that some of them, they're allergens, they have different functionalities in our body. So the level of the dose is important. But anyways, I totally understand that for consumers, they really don't care to see if the level of peanut butter is 0.2% or 0.3%. For them is there, peanut butter there or no? That's why the term, the word of contains and may contain is usually kind of the precaution, but it's being used by so many companies. They don't have the allergens, but they protect their companies against some liabilities. Okay? So sometimes you see, if the words are just being allowed to be used, so it shows that the companies, they don't have enough confidence, some of them, not all of them, in their allergen program, allergen control program, to see what is based on the very scientific approach. Do we have really risk of any kind of even cross-contamination? So that's why we say, you know what? Easy, may contain. If it happens, I told you. So that's the challenge. So, but what I strongly believe is government of Canada, not Canada, all the governments, they evolve very slowly, very slowly. I remember when I graduated here from University of Guelph. Should I tell you how long ago? So it was like 1994. And I remember when I was applying for a job, no one is asking you about HACCP. And I remember the first time I applied for a job with CFIA, the question was, what are the 7 steps of HACCP? That's it. Now, if you want to be hired with them, there are lots of questions. So we know that we are evolving. But in this regard, government needs to be a little bit more faster. You're using so many food safety programs beyond PCP or APSA program. And so their standard is above government. I totally understand. Government standard is always minimal. But we cannot compromise. But how about the education in this regard? For education, it's really difficult. Still, when I started developing the program at Cestar College, the sources we had was based on teach food regulations as one of the courses, food safety, HACCP. They are all separated. While I always used to, and still, emphasize and ask and encourage my students, make sure that you integrate your knowledge from all of these courses and analyze and decide. Decision-making based on the scientific evidence is absolutely critical for the programs. And that's why I'm very proud I see my students, that they are my friends, not my students anymore, because they have lots of knowledge, more than I do. But I'm proud of them. They survived, and they are in charge of, the position they have is excellent. But still, the food programs should be evolved. We have to separate, we shouldn't separate food regulations, HACCP, etc., food safety. And so students pass the course, finish, forget about it, let's the next. No, they have to integrate. We need. And these days, when you're at work, I'm pretty sure that all of you guys, when you face a challenge, the first thing you do is, I have to use my knowledge from food microbiology, food chemistry, government regulations, blah, 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 put together, do my analysis, make a decision. This is the way. And we still need to bring this point into our education. And I hope we will be able to do it. Plus, because science, what we know, companies, food companies, what we do, government, what must be done. So, and I guess I strongly believe colleges should translate and bring all together and make the students ready to make sure that they need minimum level of training, minimum. And so hopefully it will happen. And so that's all.
Thank you so much. So thank you to my three panelists. I think we have a few minutes to talk about questions. Before we jump into questions, I did have a quick question for everyone in the audience. I think we're all very well versed in this room and on this stage about the level of work that goes into a label. It's a ton of effort. There's a ton of regulations you look at. It's not just that simple flat label that consumers see when they go to the store. So knowing you guys are those experts, how many of you are within your families and friend groups are the de facto label expert? Hi, is this product healthy? Should I buy this one? Someone explain this best before date. I just keep throwing them out when they just say best before, even though I've never opened it. It's off by one day. Do any of you experience that by show of hands? So I think there's so much opportunity for all of us in this room to really help consumers understand and then bring them the fantastic products that everybody here has. So on that note, I'd love to open the room to questions if anybody has one for any of our panelists.
Okay, so we have a few questions. Our microphone is coming. We'll go first here and then we'll go there. You'll go second, okay? Oh, 1, 2, 3.
Hi, thank you for your very thoughtful insights about the discussion for this. But my question to you is, how do you view like the QR codes or the other things that we normally see on the label change the future of smart labeling? Is this something that I think you as a retailer, no, not a retailer, a manufacturer would consider in educating more of the consumers?
I can take that, and if you are okay with that. So QR code is an excellent tool for layering on additional information. But you have to remember that QR code is not for mandatory information. So regulation tells you what mandatory informations are from the regulations that cannot be incorporated into the QR code. But QR code can be used as a layer of additional information for transparency. For example, sustainability story of your company can be done through QR codes. Any other things that you wanted to communicate with the consumer can be done through QR codes. And we are just working on a project with FHCP to see what kind of information can we move from a label to the QR code so that we get more space in the package to do a better branding or marketing, because there are several other things that are really not mandatory from a regulatory perspective. The clear on calories, which we put on the front of pack, which is a commitment from the beverage industry to the consumers, is not a regulatory requirement. It's a voluntary requirement. Can that be moved to a QR code, which is possible? But then you have to think about equity. Does everybody in the room or in the population have a cell phone to scan that QR code and get that information? If they are not able to access the same information the other people are able to access, that's inequality. So you can't put that thing in the QR code. So you have to think very deeply. I think the real the thing would come up is when the regulators are open for using QR code to put mandatory information. I think there will be a stage in the future where most of the mandatory information are going to be transferred. I think that will be a game changer from my perspective. But I will add on to you.
100% agree with everything you just said. Perfect.
I love that answer. Great answer. Next, sorry. Yes, sir.
All right. Thank you very much for this very interesting conversation. Now, in the course of the conversation, I think one thing that struck me is the level of unawareness that a lot of consumers have been put. And that seems to be in contradiction to majority of what is said about product development. The reason why most companies will tell you they're changing products is because the consumer is demanding for such innovation. So the question then is, if the consumers are these unaware, but then we're changing products, or we are improving products based on demand from the consumers. What exactly is driving those changes? The second part to that question is, what exactly do you think can be done in terms of educating consumers on whatever it is in the products that they're consuming? Thank you.
Sorry, can you sum up that? I missed some of that. Had a hard time understanding a little bit of that. Could you just repeat one more time?
Yeah. So one of the things that came up in the course of this conversation is that a lot of consumers are unaware of the products or what the constituents of the product.
The ingredients, do you mean?
Yes.
Okay, yeah.
Yes, but then we all know that majority of the bulk of the reason why product innovation take place have always been attributed to consumer need, changing consumer need and consumer want. So how do we sort of juxtapose the two to say they are not aware, but then they want us to change the product?
Yeah, it's hard to know when they're not aware what they're not aware of, right? I think that's a mix of things, as I mentioned earlier. I think we need to kind of isolate that particular demographic of consumers that we're targeting, first and foremost. We need to know our consumers really well to then be able to ask them those kind of probing questions. So some of those like comprehension studies, just understanding where that consumer is coming from, what they want, and what they understand from that product. I think that's kind of the first step. It's not like a broad blanket brush over every consumer understands or misunderstands the same thing. We kind of need to narrow down on our target demographic. And then when things change, like it was mentioned before and it's been mentioned so many times, QR codes I think can play a really great factor in helping relay some of that mixed messaging or some of the misinterpretation, like things like ingredients, as I said, like things like some food additives that we have. What is maltodextrin? What are some of these things in there for? Perhaps the QR code information and that digital content can play a role where we don't have that physical space on label, but we do have a bunch of space digitally. That maybe that is another area where we can relay some of that ingredient additive functionality understanding in some of our products, and lots of other things like claims, and as mentioned, sustainability story, supply chain traceability. You know, opportunities are limitless with QR codes.
Thank you.
Thank you.
And finally,
Hello, I'm Naimat from AGT Foods and Ingredient Inc. So to build on what he just asked about, because I have a comment and a question, because you've said some things about the difficulty consumers are experiencing, or let's say our assumed difficult, because we don't know. But I think what drives the trend is the modern world, social media. Like he asked, most of the product development demands from consumers to change products are from trends. Somebody's saying something and everybody follow because the traditional way of thinking has changed. In fairness to CFI and regulatory body, when we are digging into some problems or when writing, or some, because I have a background academic as well, so like writing, researching on something, a topic for the company, I realized there are many, many documents that you would never discover are present, like in simple language for the consumers from CFI, that you wouldn't know if you're not working on them. But the truth is, nobody cares about those things anymore. Consumers hardly go check websites, they hardly go check the barcode, QR codes. I don't do that. I bought products and then I discovered there's no sugar in the bread because I didn't check the label. But the truth is, you pose the question, how do we educate consumers? I don't know who's gonna drive it. My question is who's gonna drive it, but I think the best way is to use the language of the world now, like the social media, the reels, the videos, short videos about this label. Okay, this is how you check your label. This is what you can quickly check. This is what it means, 5% less, 5% more. You know, things like that. But the truth is, who's going to drive it? I know regulators are not ready to start giving those short videos. Food industry, we have gathered here today through this platform. So who can help us drive this simplified, modern-day communication, social media messages about important things like the labels and stuff like that? So that's my question. Who's going to drive that?
thank you.
Yeah, I can take a stab at it if you guys are okay. Sure. So like I said, you know, complex problem cannot be solved by one person or one stakeholder. So it has to be a congruence of, you know, the regulators, the industry, the other stakeholders, you know, trade associations. Everybody has to come together and have a strategy of how to make this happen in the real world, right? So social media is a great example of how we can communicate this, because most of the younger generation are using social media as their source of information. But that's not the only source, because we have other populations who do not look at social media, for example. So we have to have other campaigns, whether it is Twitter or even webinars or other things. But as an industry folks, you are in regulatory world, you have a role to play to educate the consumers as well. So whether it is your family members or other things, you have a big role to play. So I think combining all those together is what makes an effective way of educational campaign. There is no one silver bullet that can solve this problem. So that's my take. Thank you.
Wonderful. I think we're at time, so thank you so much, Dinesh, Parvis, Maida. Really appreciate it, and thank you all.
Thank you.
Thank you.